other movement disorders.
Is it true that we're now seeing a lot of death from psychiatric drugs? Absolutely yes.
För det fjärde, personlighetsförändrande medel kan orsaka beroende och missbruk.
One of the hallmarks of informed consent with psychiatric meds is you have to discuss the potential for addiction.
The vast majority of psychiatric drugs create psychological and physical dependency.
Most patients that I've seen that were on these drugs have difficulty getting off of them. It's rare for somebody to just be able to stop it without a problem.
För det femte, de flesta psykiska problem orsakas av en bakomliggande kroppslig sjukdom.
Many physical conditions can cause mental problems or what pose as psychiatric symptoms, but the psychiatrist, in the records I've reviewed, psychiatrist does not do an in-depth study of what could be causing the problem.
And if the doctor isn't taking the time to find the cause of those symptoms, then unfortunately those symptoms may continue and there may be a serious underlying medical disorder that's being overlooked.
The question is it better to treat depression with a drug, or is it better to treat depression by trying to figure out what caused the depression and working it out with the patient?
Dehydration can make you exhibit symptoms of depression. Sleeplessness can make you exhibit symptoms of depression. Eating a terrible diet, hypoglycemia, being sedentary, all of these things are biological reasons for having symptoms of depression.
I have in my practice children who are misdiagnosed as having ADD, ADHD, who really have Lyme disease.
70% of all what are classified as mental illnesses actually have a physical cause, a physical problem causing that.
För det sjätte, oavsett hur allvarlig den emotionella eller psykologiska påfrestningen är, finns det många effektiva alternativ som inte inbegriper personlighetsförändrande medel.
Once you've proven that there is no problem in the body and that there is no malfunction in the brain, then you have to begin to address these other levels of the self. And I think that's what psychiatry has completely stopped doing.
There are very few conditions that cannot be treated by other methods than the use of drugs.
Any forces that impinge on medicine that make us think that the drug approach is the only approach is undermining good patient care.
Och eftersom patienten sällan får höra om alternativ utan preparat ges nästan aldrig verkligt informerat samtycke.
When you get into informed consent, it's almost a responsibility of the patient to make an inquiry about the hazards of the drug and not rely on what the psychiatrist or physician tells them.
We can't go in and abdicate our responsibility as consumers simply because somebody has an MD after their name or someone is a psychiatrist and we think they know more than we do.
The best way to protect yourself is to educate yourself, is to ask questions not only of your doctor but to do your own research.
Don't be ignorant, be informed. Get information from as many places as you can. That's how you'll be an intelligent, skeptical consumer, and that's how you will protect the safety of yourself, your children, and your entire family from this industry of death known as modern psychiatry.
Och efterhand som psykiatrin har spritt sig globalt de senaste 50 åren har även neddrogning med personlighetsförändrande medel spritt sig. Men det finns ett sätt att avslöja dessa medicinska övergrepp. Genom att rapportera alla klagomål om och biverkningar från psykiatriska medel till ditt lands läkemedelsmyndighet. MedWatch är det federala rapporteringsorganet i USA.
MedWatch is a voluntary reporting system, a passive reporting system where doctors, patients, healthcare providers, pharmacists, anybody really can make a report saying that they think that what they experienced or what their patient experienced was an adverse drug effect.
And this is what we call post-marketing surveillance. And this begins to get a look at what the side effects of long-term or chronic use of these drugs really is.
The FDA admits that probably only 1% of all the adverse drug effects are actually reported by patients or physicians.
Det är bara genom att rapportera alla biverkningar från olika preparat som den sanna omfattningen av ohyggligheterna med personlighetsförändrande medel kommer fram. Du har alla fakta. Visa denna video för din läkare och låt inte dig själv, dina vänner eller din familj bli nästa statistik i den goda affären med personlighetsförändrande medel. För att få reda på mer om psykiatri och personlighetsförändrande medel eller för att rapportera ett fall av psykiatriskt övergrepp, kontakta Kommittén för mänskliga rättigheter.